In the canine world, a moderate amount of licking is part of normal hygiene. A quick swipe of the genital area after urinating or return from a walk is a functional, healthy grooming habit. However, this functional grooming becomes a medical concern when the licking turns aggressive or persistent, constantly interrupting the dog's daily activities. For many owners, the first instinct is embarrassment. It feels like a public bad habit to be scolded, particularly when the dog won't stop in the middle of the living room. This obsessive behavior functions as a check engine light, signaling active internal discomfort. Effectively resolving the behavior requires a shift in focus toward the hidden secondary symptoms that are actually driving the dog's focus. The first diagnostic zone involves the urinary and reproductive systems. Owners should look for specific physical changes: straining to pee, producing very little urine, or unusual discharge like pus, blood, or cream-colored fluid. This view of the lower abdomen shows how bacterial infections or mineral stones accumulate deep within the tract, creating internal irritation. This inflammation radiates outward. The dog feels an urgent need to soothe the exterior genitals, even though the source of burning is buried inside. If this licking is accompanied by lethargy, vomiting, or a swollen belly in an unspayed female, the situation has reached an emergency level. These signs point to pyometra, a fast-acting infection where the uterus fills with pus, requiring immediate surgery to save the dog's life. When chronic licking is paired with systemic illness or urinary struggle, the hidden internal infection is often at a life-threatening stage. If the internal tracts are clear, the diagnostic focus shifts to the exterior skin. Look for severe redness or swelling tissue, pustules, or a foul odor. These symptoms often result from vulvar fold dermatitis, a condition caused by a dog's natural anatomy or obesity. In dogs with recessed anatomy, excess skin creates dark, moist pockets. Trapped urine and poor airflow allow bacteria to multiply in hidden crevices. The dog licks for relief, but the abrasive tongue creates micro-tears, pushing the infection deeper into the tissue. Stopping this cycle requires more than just training. It often needs medicated cleansing or even a reconstructive surgery called episioplasty to remove the problematic skin folds. Structural skin issues cannot be scolded away. They require physical hygienic intervention or anatomical changes to remove the bacterial breeding ground. In some cases, the genitals look perfectly healthy, yet the dog continues to lick aggressively or scoot their rear across the floor. This often signals impacted anal glands, small scent organs that have failed to empty, becoming swollen, painful, and causing discomfort that radiates through the entire groin. If a veterinarian rules out every possible physical, structural, and parasitic cause, the diagnostic search moves to the mind. Canine compulsive disorder is a neurological condition where chronic stress, anxiety, or boredom manifests as repetitive, uncontrollable physical behaviors. As seen with this golden retriever, these compulsive behaviors can target the limbs or the genitals, eventually leading to self-injury. The licking begins as a self-soothing coping mechanism for stress, but with enough repetition, the behavior becomes hardwired and persists even after the original stressor is gone. When the body is sound, aggressive licking points to a suffering mind, requiring behavioral modification and potentially psychiatric medication. The most common reactive response to this behavior is to simply put the dog in an Elizabethan collar to force them to stop. While the physical barrier stops the action, it does nothing to address the underlying disease. With a cone alone, the dog is left to suffer in silence from the burning of a UTI, the pressure of an impacted gland, or an irritating skin infection. A more effective approach involves monitoring bathroom habits, checking for tissue redness, and noticing any changes in odor. Persistent licking is a nonverbal plea for help. Documenting these specific changes in habit and appearance gives a veterinarian the exact evidence they need to treat the cause.